On the evening of Monday, September 9th, 2024, Montgomery County Fire and Rescue crews from Stations 6, 7, and Rescue 1 were dispatched to a residence in Bethesda for a report of a patient experiencing a seizure. En route to the call, the incident was upgraded to a cardiac arrest. Upon arrival to the scene, crews found an unresponsive patient lying on a sofa with agonal respirations and weak, thready pulses. The patient's family stated that they were having a conversation when she developed chest pains and then passed out. The patient's family states that the patient experienced a similar episode in February of 2024. MCFRS crews moved to the patient from the couch to the floor, and the patient promptly went into cardiac arrest. High-performance CPR was started, and the patient was placed on a cardiac monitor with initial rhythm of ventricular fibrillation. The patient was defibrillated, high-performance CPR resumed, and the patient was ventilated via a bag valve mask. The crews established vascular access via IO and administered epinephrine. At the second pulse check, the patient remained in ventricular fibrillation and was defibrillated a second time. A second dose of epinephrine was administered, and an eye gel was placed to secure the airway. At the next pulse check, the patient had a return of spontaneous circulation with strong, palpable pulses present and sinus tachycardia on the cardiac monitor. The crews obtained a 12-lead EKG, assessed patient vitals, and continued to provide assisted ventilations. The patient began to buck the tube, so the crew administered ketamine to sedate the patient. The patient was packaged and moved to the EMS unit to prepare for transport to the hospital. En route to the hospital, the crews continued to monitor the patient's condition and vitals, perform serial 12-lead EKGs, and consult with Suburban Hospital via EMRC. Upon arrival to the Suburban Hospital, patient care was transferred to the waiting emergency department staff. The patient was intubated and transferred to the intensive care unit for further treatment and evaluation. The patient was taken to the cardiac catheterization lab and eventually had an internal defibrillator placed. The patient was transferred to Johns Hopkins Hospital to treat spinal fractures. The patient's condition continued to improve. Thanks to the knowledge and skills of the MCFRS crews on the scene and the excellent care from the staff at Suburban Hospital and Johns Hopkins Hospital, the patient was discharged home, neurologically intact, on September 25th, 2024. Montgomery County Fire and Rescue Service is proud to recognize our personnel for their dedication, professionalism, and teamwork. The patient wrote a note to Montgomery County Fire and Rescue, and I'd like to go ahead and read that. There are not enough words to describe my gratitude and thanks to the men and women who serve as first responders in Montgomery County, and specifically at the BCC Rescue Squad. I am fortunate to live in a county with excellent emergency response providers and healthcare services, and I would not be alive or here today without such services. This past January, I went into cardiac arrest and stopped breathing. When I woke up, there were several first responders in our family room who convinced me that I should go to the hospital and get checked out. I was transported to the hospital, but after a night of emergency room and lots of tests, there were no definitive causes found. On September 9th, I had another attack. This one was much worse, and I did not come out of it right away. My family tells me that the crew that came to our house that night worked tirelessly for over 15 minutes to get my heart beating again and stabilized enough for me to be transported to the hospital. I was diagnosed with ventricular fibrillation, which I later learned can be deadly if not treated by medical professionals quickly. I'm very fortunate that the crew that came that night did not give up on me. Although I have no memories of the next 2 weeks, I did, however, get a defibrillator implanted to protect my heart from future cardiac arrest. My family and I will forever be grateful for the gift of life that I have been given due to the hard work and dedication of those at BCC, Rescue Squad, and MCFRS.